we're going to talk about what to expect if you have to go through a cesarean section or a C-section. So mentally, whether you have planned a normal birth or a water birth, and if you're being told that there is something wrong, or that the baby's movements have reduced, or there's something up with the placenta or the cord, and that it's much better or much safer for both the mother and the child if they go for a cesarean section. I'm just making this video just to prep you of what you could expect during a cesarean section. So I was actually planning a normal birth, but by my 35th week, we noticed that there were some abnormalities in the growth of the baby, and my doctor had suggested that the baby be born on the 37th week. So we had attempted for a normal delivery. I was being induced for a normal delivery, but as the heartbeat was not as expected and the baby's movements were slowing down, I had to be admitted for a cesarean section. So that is a little stressful for you. Like, it's a little overwhelming when they tell you, okay, there's a danger to the baby, and that's the reason that we would have to do this. So you need to be mentally prepared that if it's in the best interest of the baby, that you put away your birth plan of having a normal birth or a water birth or whatever birth plan that you had and go with the emergency plan. So let's get into what to expect during a cesarean. Now, since I was being induced, it was planned that, okay, on this certain date you would be having a baby. So I was admitted the previous night. The nurses did prep the body for both, for normal as well as for a cesarean. So basically, they would make your body sterile from your final rib right up to your knees. So it's cleaning of everything, and it's becoming a sterile surface so that they could have the emergency operation if required. So that would be done maybe a few hours before the doctor actually sees you. That would be prepped by the nurses. And after that, you would be connected to a machine that monitors the heart rate, and there would be a graph that would be continuously monitoring you and the baby. They would give you some drips, maybe some vitamins, or you would, if you haven't had your tetanus shots, you would also be given another tetanus shot. If they know that they're not attempting for a normal delivery and going directly for a cesarean, then they would ask you not to eat anything from the previous night if the cesarean is scheduled for the next morning. Whereas in my case, I was they were trying for normal. So regardless, they said there might be a chance that it would end up being a cesarean. So I wasn't allowed to eat. So I had eaten the previous night, and if you've been following my videos, you know that I was nauseous the entire time. So I had ended up puking right up till entering the labor room. So in case if you have been eating, they might give you an enema. You need to be prepared to receive an enema. They might give you an enema to clear your bowels. And apart from that, after the cleaning, you would be given a drip, you would be given the hospital gown to wear, like the birthing gown, and they would also give you a catheter, just insert a catheter into you just before being wheeled off into the operation theatre. So the catheter also would be put in by a nurse, not by the doctor. They would also do examinations prior to that to check if your dilation, they would check how much the baby has been effaced and things like that. So there would be a few internal examinations to check the position of the baby's head. They would check if there's any fluid leakage. They would check if you're dilated. So things like that. There would be internal examinations. So you need to be prepared for that as well. The key to it is relax as much as you can. The more you relax, the less painful that it is. Block out all your thoughts. Think happy thoughts. Think thoughts that are completely random and not related to what's happening, and that's going to help you to relax. Your body is made to birth, like your body is preparing for it, so don't stress about what's happening, what's going to happen. These doctors know what they're doing, so just trust them and go with the flow. Once they schedule it and once they tell you, okay, now it's time, you would be wheeled. Now, in my mind, I was always imagining that you would be lying on a stretcher and you would be wheeled right up till the delivery in the stretcher. It doesn't really happen like that. So you're not on one single bed that's being wheeled off. After they've inserted the catheter, they would transfer you into a gurney, or rather a bed with wheels rather. They would roll you in to the elevator and to the operation theatre. When you reach the operation theatre, they would transfer you again onto another table. Some hospitals do use a Velcro, and they would keep your hands steady, or if they are connecting it they would actually have you stretch out your hands onto a longer table, and don't worry, they're not crucifying you or anything. You can move later. They're just examining you and checking the positions. If you have opted for a cesarean, or if you're going through a cesarean, that is when you might have the spinal injection or general anesthesia, depending on what the doctor is taking into consideration. I'll leave that up to the medical professionals. I'm only talking from a patient point of view. So there was an injection that was given to me in my spine. It wasn't very painful. First, they gave me a very small injection, I guess, to numb the area, and after that they had given me the spinal block. I had my eyes closed, but so I didn't really see the needles, and it's at the back of your head anyway, so you're not going to be able to see what size or anything. That's not going to be scary, but it would be nice if you could have a friendly nurse in the room, maybe just smile at her, or they would hold your hand so you could get some comfort in that. So I was just holding the nurse's hand, and she had a very pleasant face, so that actually distracted me from what was actually going on. And once the anesthesia sets in, they might ask you to wait about 5 minutes, and then they take you into the main operation table. And then it starts with the draping, and it's really cold inside an operation theater. Like, I have never been in an operation theater before, so entering the operation theater was more of a sightseeing for me. It's not a small room like you see in the television on all these shows on Grey's Anatomy, where you think, oh, it's a really small room. It's actually very big. Operation theaters are quite big. It's like a warehouse, and it's freezing cold and very sterile. And there are a lot of people there. Like, I did not expect that there would be so many people, and they're all wearing gowns, so you don't really know who's who, because they have their masks that cover their faces. So it's a lot of people. Like, you have the anesthetic team, you have the cardio team, you have the NICU team, you have your gynec, then maybe some specialty doctors, and especially if you have any complications, in those doctors. So you can be prepared to see at least 10 to 20 people in the room. And if it's a teaching hospital, even more. So don't be overwhelmed, because everybody is just part of the process, and once things get moving, it's going to go like really fast. Especially cesarean just finishes very fast. So I was I'm on the table, and the spinal block has been given. Then they start putting up these drapes. So if you're lying flat, the drape comes up right like above your forehead, so you can't really see what's happening on the other side, like if the doctor cutting, and you can't see any of that. So it's nice to have a nurse who's looking at you, or a doctor who's looking at you, because you can see them and you're conscious, so you can hear whatever they're talking. You can hear, you can't feel anything. Like, they would check if the spinal block is working, but maybe they'll give you a few pinpricks here and then ask you, do you feel it, and as long as you don't feel it, it's fine. It means anesthesia is working. And the nurses also put a very cylindrical blanket that had warm air coming through, so I don't feel as cold. And I was more distracted about the warm blankets that I realized that the baby is already born. So the cesarean was very fast. The doctor just came in, she did her thing, her job, and they actually cleaned up the baby and then showed me the baby. And this would have happened in less than 5 to 10 minutes. So basically by the time I was sightseeing the operation theater and looking at the nurses and seeing how many people were there, and I got distracted with the blanket, the baby was already born. So I did not have any pain or any discomfort. It was done. And then they showed me the baby, so that was nice. Baby was all wrapped up, and you would feel so, like, I mean, you're all drained because you're just going through. But seeing that baby would give you so much of joy, and it's an experience. Like, even if it's a cesarean or it's normal, but just seeing your baby for the first time. And also, before they showed me the baby, the doctor has to examine the baby, and they have to check if the baby is crying. So I actually knew that the baby was taken from me. Like, there was no pain, but I knew when they had taken out the baby. And I also knew that I'm not hearing any sounds. Like, I can't hear the baby cry. But maybe after a few seconds, I did hear the baby cry, and I was like, wow, okay, everything is fine. And then I asked the doctor, is everything okay? And the doctor was very calm, and she was like, yeah, everything is fine. They're just examining the baby. And then they showed me the baby. So then I was rest at ease. Then the baby is not kept in the operation theater with you. They take the baby away, and they do the cleaning and checking the baby and monitoring the baby. So after that, I don't see the baby at all. I don't hear the baby. The baby is already gone from the room. So I'm still in there, and then the doctor is all finishing her job, and she's stitching or whatever. And once the operation is over, Then they would tape you, or depending on your stitches, they would drape you once again, and then you are wheeled from the operation theatre into the recovery room. Now with me, I thought, okay, the operation is over, they're going to take me back to the labor room, but they didn't do that. They left this gurney in the recovery room. Now one thing that you should expect is, soon after the operation takes place, they're not going to take you on the table. They have to move you from the table onto the gurney to take you to the next room. So that might be a little difficult for you, because you're not going to be able to move because you already had anesthesia on your legs. So they may carry you onto the gurney and then take you. I'm not sure if gurney is the correct word, on the the stretcher with the wheels. Okay, so they just take you on that. So once they put you on that, it's fine. So they might just lift you off the table and put you onto the gurney. At that point, they would also check for where your urine bag, the catheter, is connected. So that's the only wires that are there. They would carry the drip also with you. So you can just feel a slight discomfort at that time while being moved, mostly because you can't move yourself because of the anesthesia. So you're dependent on 3 or 4 people just lifting you and placing you. I think of all the cesarean, that was the catheter part was just the most, what caused the most discomfort. The injection was fine, the whole process was fine, I didn't feel anything much. Then they would take you back to the recovery room. What I wish somebody told me was that that's the recovery room to go to sleep. The thing is, they expected that I would go to sleep, and they left me there for 2 to 3 hours. But I was under the impression that they're going to come now and wheel me away. So I stayed awake. But actually, I think if I had slept, I would have felt much better. So if you're in a situation where you can ask the nurse, okay, how long will I be here for? So you can know whether it's going to be a few hours, then you can take a nap, you can go to sleep. My cesarean was about 2 o'clock in the afternoon. I was taken back to the labor room where I was by about 5:30 in the evening. So they actually left me there for 2 to 3 hours just to sleep. And I did sleep for a bit because you're so tired after the process, and I did sleep for a bit. And after the cesarean, that evening, they brought the baby back to me again. And once I was taken back to the labor room, they brought the baby to me to attempt to feed. They had already given the baby one feed of formula, because I was, obviously, since I'm in the recovery, I couldn't feed the baby immediately at birth. So they had already given baby one feed. My husband and my family had already seen the baby. Then they brought the baby to me in the labor room. I did attempt to feed the baby. And then after that, they give me a few sedations and some painkillers. And then they asked me to sleep. They said they would bring the baby back in the night. Now, to talk about post-delivery care, the first day after cesarean, since mine was already in the evening and I had showered in the morning, they told me not to shower, especially that my heart rate was a little too high, so I was being connected to the machines. But in some cases, they do allow you to take a shower once you're back and you're feeling better. They might also assist you. If you want to have a bath, you can ask the nurse for help, and you can actually get some assistance. The next day in the morning, they actually disconnected me from the machines because I was back to normal. My heart rate and my blood, everything was back to normal. My pressure had come down. And if everything is okay, then they move you back to your room. Like from the labor room, you can be taken back to your room. And they do give you ibuprofen and the painkillers. Now the thing what happened with me was the doctor had prescribed it, but since I was not complaining of pain, they did not administer it, meaning they did not give it to me, thinking that okay, I'm not going through that much of pain. But actually I wasn't aware that they won't give you extra painkillers unless you ask for it. So always ask for your painkillers. You don't really have to go through with the feeling of having your the whole incision. And the incision would hurt for the first 3 days. I'll be very honest with you. It would hurt for the first 3 days. You would have bleeding. And even though it's a cesarean, you would have bleeding, like normal bleeding. You could use your sanitary pads or your adult diapers. I've done a video on that. You could watch that video as well. And there would be a lot of bleeding. There would be pain and soreness on the first day, like even getting out of the bed and going to the toilet, because they would remove the catheter once they move you from the labor room to your room. So you need to get up and go to the toilet, and that would be painful. And standing up. Now the biggest and the most important thing that the doctor would ask you to do after a cesarean is to stand up straight. They are not going to move you from the labor room back to your room until you can stand up straight. So they would make you walk. It would be painful, but it's only for the first day. Like first few times, I know I was half bent up and I was walking until the doctor told me, like, please don't bend, try and stand up as much as you can, because that is the recovery period and you need to get your spine back straight. So the doctor used to tell me, like, come on, up, you can do it. Like, it's all about staying positive and allowing your body to go through it. The pain is temporary. I'll tell you, I went through the cesarean. The pain is temporary. It's not going to pain forever. It's not going to be like this. Although at that time you're going to think like, okay, I'm in so much of pain, but there are painkillers. You can just ask your nurse to give you the painkillers and just try and stand, and know that only if you stand can you carry the baby, or can you sit up, can you feed the baby, because it's a little difficult to feed the baby lying down. And I'm going to do another video of feeding techniques of how you can hold the baby after you have your cesarean, because the weight of the baby is always going to come on your abdomen, and at that time, even if it's a cesarean or a normal, your stomach is not going to go back down immediately. So the weight of the baby on your stomach is going to give you pain on your stitches. So wearing a binder, you could check with your doctor when you can start wearing a binder after your cesarean section. Now coming to your stitches, on the first day after your cesarean, there would have been a bandage, band-aid, like a big block put onto the incision, but the nurse would probably remove that the next day, and they would put ointment and some powder and something to clean it up, and they would ensure that there is no liquid oozing out, there's no blood, and that it's drying. So you also won't be able to move much the first 2-3 days. So don't stress, have somebody else look after the baby. The first 3 days in the hospital, you would really need somebody by your side, if it's better if it's your husband or your mom, so somebody who can be hands-on with the baby. And you're going to be very emotional. I'm going to just take this raw now, like I'm not going to sugarcoat it for you. You're going to be very emotional. You're going to be in a lot of pain just the first and the second day. So going to the toilet will be difficult, sitting up to feed the baby will be difficult, eating would be difficult, but the morning sickness would have gone. You don't feel pukish anymore. That happened like immediately. Okay, so you can eat, you would be hungry, but at the same time you wouldn't have enough energy to eat. We also would be introduced into having the responsibility of looking after the baby. So now is when it dawns on you that, okay, all this while the baby was inside of me, so I didn't really have much. I didn't have to change the baby, I didn't have to feed the baby, but now you have to feed the baby, and the baby poops and you have to change the baby. So having somebody there who can help you to do this would be great. Post cesarean, you have to get used to feeding the baby, so how you hold the baby. The nurses would help you with your first few challenges of getting the baby to latch on, to feed the baby, and basically just to bond. Like, even if you're not able to have milk, or if it hasn't started coming, and especially because it's a cesarean, sometimes it takes 2 to 3 days for your milk to kick in. So even if it's just bond with the baby, because see, the baby has known you this 9 months. They know your smell, they know your heartbeat. So even if you just hold the baby close to you, it's comforting for the baby. So try and bond with your baby as much during those first 2-3 days, and that will go a long way in your journey later. Like, so cesarean recovery is quite a fast process. Unlike what they say, oh, cesarean is very painful, you will have back pain for the rest of your life, and you will have to be on bed rest for 3 months. I would say none of that. I rested for maybe 3 days. On the 4th day, I was brought home. I could take naps and I could have rest, but 24/7 bed rest is not possible, because you have a tiny baby who's entirely dependent on you. So you have to look after the baby, and that's like responsibility that's come on you. And the thing is that you don't realize that when you're in the hospital, you are the patient, because you are the one who is going to give birth. So even if you have learned a lot, you need to know that at the end, it is between you and the baby. There's nobody else, whether it's your husband, whether it's your mother. At the end of the day, it is you and your baby. So you need to bond with the baby, you need to feed the baby, you need to recover and heal yourself, so that you can look after the baby. So I would say the biggest challenge is the first 3 to 4 days. The first 3 to 4 days, once you get over the first fifth day and you're back home, then it's fine. It's not like so painful or anything. You can handle it. You can do your daily activities. Okay, prevent like lifting water and sweeping and swabbing your entire house. Don't do anything like that because you just had abdominal surgery. But don't have a surgery, but you can actually look after the baby, you can change the baby, you can bathe the baby, it's fine. You can do all of that. And it's not like so painful that you can't walk around and you'll have to be on complete bed rest. It's nothing like that. Nowadays it's modern science, so stitches are not like before. You don't have to go back and get your stitches removed. The stitches are soluble. Some of them you might not even see the stitches. The stitches might be inside. You can also talk to your doctor about what kind of stitches they would be doing for you. So don't worry about if it's a cesarean. Cesarean, you will take 3 to 4 days to recover and to get over the pain. They will give you painkillers, so you don't have to worry. And once it's 4 days and you're back home, I think the recovery is fast. Once later on, hot baths help. And if you can, once your incision has healed, you can go for a binder. You can do a stomach binding either with a cloth or use a Velcro binder that helps you. And that would actually support your stomach so that when you move, the incision doesn't move and it doesn't hurt you as much. Use the maternity abdominal underwear. You will have to be using that underwear at least for the next 6 months because anything else is going to hurt you on your incision. So that's what I went through during the cesarean and the post-recovery period. I would say just moisturize a lot even after your delivery because that's going to help. It's going to be very itchy. So use a lot of moisturizer. Try and get rest. Sleep straight. Don't sleep in a curved position. Sleep straight. Give your spine enough support. Have hot baths. If you can do the massages, if you can have those malish walis come in and give you the massage, that's good. Check with your doctor when you can start, depending upon your healing and when the doctor says, especially if it's a cesarean. And hot baths help a lot. Regarding breastfeeding, until you get the hang of it, it might be a little challenging, but it's a tiny baby and you want to feed the baby. So whether or not you have enough of milk supply or whether your milk is too much, so you need to know how to treat your engorgements. You're going to have a checkup with your doctor. You will meet your lactation consultant, so they're going to help you in giving you techniques of how to get the baby to latch on. You might have engorgement, which is a bit painful. Some tips that you can do is use a hot compress, use a warm cloth, or even use a pump to pump out the excess. And it's not going to be like that forever, just until the first 1 or 2 weeks, until your body gets accustomed to what the baby needs. So all this pain is temporary. It will pass. If there's only one thing that you take away from this video, is know that the pain is temporary. It will pass and you will be back to your normal self soon. So don't worry if you're doing a cesarean or if you're having a normal delivery. Cesarean isn't that bad. I had a question to the doctor, like, if it's a cesarean, will my next baby also be a cesarean? How many children can I have? Does it mean that I can have only 2 children? And she told me, relax, you can have as many children as you want. It depends on how your incision heals and how you want to have whether you want to have so many children or not. She said there have been cases where women have even had 14 cesareans. So she's like, don't worry, you can have 2 or 3 children as much as you want. And it's not necessary that it always has to be a cesarean. It will be followed by a cesarean. You can have a normal also. It's called a VBAC. You can get more research on that. So don't worry, just know that the pain is temporary. It will pass, it will go, and you will heal. The human body is amazing, and it's just meant, even if you tatter up and break your bones, you will heal. Even if you are sliced and if life is taken out, you will heal. So you need to prepare yourself. Just be mentally and positive. Remain positive, concentrate on it, relax. Don't keep your mind on, oh, I'm going through so much of pain or this or that. So try and block your mind out of the pain. If it's too much, do ask for painkillers. Also do check out my video on the 4th trimester that will be coming up next week. So you could look out for that, and that will give you some tips on how to handle postpartum. I hope this video helped you. Stay positive. Bye.